topics and opinions expressed on the following show are solely those of the host and their guests, and not those of W4CS Radio, its employees, or affiliates. W4CS makes no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. Any questions or comments should be directed to those show hosts. Thank you for listening to the Cancer Support Network on W4CS.com. Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
Welcome to 5 to Thrive Live. Hello, everyone. Sorry for our delayed start today. We were having some technical difficulties, but it seems to be working, although I see there's somebody in the chat room that's having trouble listening. So we're going to assume that things are going well. Chad, maybe you can just check it out a little bit. And this is 5 to Thrive Live. I'm Dr. Lisa Schuler, the host of tonight's show. By the way, if you were on while we were having technical difficulties and you cannot hear the show, refresh your page, which you probably can't hear me say because you can't hear the show. But anyway, if you're having trouble and you can hear me, refresh your page and we'll get going. All right, so this is 5 to Thrive Live. We are all about giving you information and bringing really wonderful guests to you that will have insight and inspiration about various topics related to health. This show is co-hosted by Carolyn Gazelle and myself, and we are also the authors of 2 books on the topic of cancer, The Definitive Guide to Cancer, and 5 to Thrive, which is coming out as a new edition in September under the title The Definitive Guide to Thriving After Cancer. And our goal is to empower you, and we could not do that without the very generous support of our sponsors. Our sponsors include Cetria Glutathione, Cognizin Citicoline, Tomorrow's Nutrition, and Natural Health International. We really do appreciate our sponsors so very much. And I also want to just let you all know that if you want to see the rest of the schedule for the week, go to our website, 5tothriveplan.com. You can check out our radio page, and while you're there, check out our digital magazine. It's an amazingly beautiful and informative magazine that we're going to send out every other month. Very low subscription price of $8.95, so I hope that you check that out. And we are going to get started because we have a really interesting topic today, and I have a wonderful guest with us. Dr. Laurie Steelsmith is a naturopathic doctor, licensed acupuncturist, and somebody that I have known for many years now. I won't say how many because that'll tell you how old we are, but she is a practicing physician and acupuncturist. She is fortunate enough to live in the very fine state of Hawaii, and she's also the author of a best-selling book, Natural Choices for Women's Health, which came out in 2005. She's the co-author with Alex Steelsmith of a book called Great Sex Naturally, Every Woman's Guide to Enhancing Her Sexuality Through the Secrets of Natural Medicine. She was on our show previously talking about that. It was a great show, so you can look through our archives to check that out. And she has a busy practice, which she's been doing since 1993. The Honolulu Weekly has credited her with being the best alternative practitioner for women's health in Honolulu. So, Dr. Steelsmith, welcome to 5 to Thrive Live again.
Oh, thank you. My pleasure.
Well, it's great to have you on. And, boy, you decided to talk about, I think with some encouragement, a pretty interesting thing today. The topic of the show is drugging our daughters, but I think specifically what we're going to focus on is HPV and some of the things that the healthcare system is doing around HPV and implications around that, and we're going to kind of dissect that a little bit. So before we kind of get all into that, let's maybe just start by, if you could just tell our listeners a little bit more about yourself and how you developed such an interest in women's health and women's sexuality.
Well, great question. I developed an interest in women's health and women's sexuality really because being a naturopathic doctor, I saw a lot of women. I worked with you back when we were in school in the 45th Street Women's Clinic. I saw that there was a lot of medicine being given to women that seemed a little inappropriate at the time, and I wanted to be able to drill down into what else can we offer these women who are wanting to prevent sexually transmitted infections. I wanted to know what we can do to help women through hormonal changes, and I have a real keen interest in helping women to find ways that they can maintain health and vitality in their lives without having to over-medicate themselves. And I think that this population, the teen population, is of particular importance because if we can help young teens understand their bodies, give them education, as well as give them the tools to keep their bodies healthy, then they can really bypass a lot of pain and suffering as they get older, and they can live much healthier, more vital lives.
Absolutely. So very true. And I think in some ways, the teen population is a little bit of a neglected demographic in healthcare. I think that they aren't as inclined to go to the doctor, and I think a lot of doctors feel a little bit at a loss in how to interact with teens. So I really appreciate your focus on that. And, speaking of teens, I think sexuality certainly comes up as something that is a potential threat, I guess, if for lack of a better word, to people's well-being as they're growing into their adulthood. And one of the things that is at the forefront of this issue is HPV. So start us off by just telling us what HPV, or human papillomavirus, is.
So HPV, it's a virus that is sexually transmitted through mucous membrane contact, and it's insidious. People don't know that they have it until, let's say, they end up with an abnormal pap smear, or if they end up with actual visible warts. The HPV virus, it can also affect mucous membranes of other areas of the body, such as the oropharynx, which is the throat, and it can affect the anal mucosa, the vaginal mucosa, the vulva, and the vagina. So, and there are certain strains of this virus that can lead to cancer, and it can lead to cancer much later on in life. So teens could contract this virus when they're younger, and if they don't clear the virus, meaning that their immune system doesn't fight it off, it could lead to cancer later on in their lives. And in fact, the high-risk strains of HPV are associated with 70% of cervical cancer, and this virus has been implicated in 99.7% of all cervical squamous cell cancers worldwide. So it is a huge sexually transmitted infection. There are many people who contract it. What I found so interesting in the research I did for this show and for my patients is that 70% of young women clear the virus within 1 year, and 90% clear the virus within 2 years. So when we're looking at using a vaccination like Gardasil, we're looking at treating 10% of people. We're looking at trying to prevent cancer in 10% of the people exposed to the virus. The virus is the third most common cancer in women in the U.S. Cervical cancer is the third most common cancer in women in the U.S., and it's the second most common worldwide. So yes, we're treating just 10% of the population who go on to have this cancer, and yet this cancer is a very serious cancer.
Yeah, so it kind of creates a dilemma. I mean, I can see, why there's been such a push for this vaccine, because it's considered truly a preventable cancer, which is something that is unusual. A lot of cancers, by the time they're at a diagnosable stage, they're not truly preventable. But in this case, an abnormal PAP, for example, especially if there's some virus, some testing for the virus, if that's diagnosed, it can be treated at that stage and the cancer can be prevented. And then I think the current thinking is, well, let's back that off even earlier and see if we can vaccinate and prevent this even further. And I know that this is actually quite controversial, so I'm going to leave our listeners hanging for a moment. We're going to take our first break, and when we come back, I want to dive right into Gardasil and the vaccination issues related to HPV. We'll do that when we come back.
Green tea is good for us. It's a key part of the 5 to Thrive plan. What if you don't care for the taste of green tea? And with so many green tea supplements, how do you choose? No one wants to waste their money on a poor quality product, and I know I want organic to avoid the harmful toxins. That's why you should choose Sunfinin. Sunfinin from Tomorrow's Nutrition gives you the highest quality green tea possible, and they offer a 100% satisfaction guarantee. They have confidence in the quality of all their products. As a special offer to 5 to Thrive listeners, Tomorrow's Nutrition will give you 20% off your order. Go to tomorrowsnutrition.com and type in the code 5 to Thrive when you check out, and you'll automatically receive 20% off your order. Get quality. Get results. Get Sunfinin Green Tea from Tomorrow's Nutrition. That's tomorrowsnutrition.com. And don't forget to type in the code 5 to Thrive to get 20% off your order.
Ladies, are you confused about hormones? You're not alone. Even scientists and doctors don't seem to agree on what to do about hormone imbalance. As we age, hormone production can fluctuate, impacting our cycle, PMS, skin, and even fertility. Hormone loss that naturally occurs as you approach menopause can impact bone, heart, and even mental health, not to mention make menopausal symptoms worse. Luckily, there is now an answer. Feminescence is the natural solution born out of 5 years of research and clinical trials. Feminescence does not introduce any hormones into your body. Rather, it nourishes your hypothalamus, pituitary, and adrenal glands, naturally supporting your own production of all hormones. With a different product for each stage of a woman's life, you can find the Feminescence product that is right for you at naturalhi.com. That's naturalhi.com, or ask for it by name at your local health food store.
Welcome back to 5 to Thrive Live. I'm Dr. Lisa Schuler, tonight's host. Our guest tonight is Dr. Laurie Steelsmith, and she is talking to us about, I guess most specifically, we're really focusing tonight on HPV and some of the controversies around HPV. It's pertinent, obviously, to 5 to Thrive and our listeners because HPV is a well-recognized and quite significant risk factor for cervical cancer. So one of the things that the health community has developed in response to this risk factor is a vaccine. And as far as we know, there's 2 vaccines that are in use. One is Gardasil, the other is Cervarix. And Dr. Steelsmith, I'd love for you to tell us a little bit about why vaccines are utilized and what the intent of the vaccines is. And then we'll kind of come back and talk about maybe some of the issues with them.
Okay, so they've developed vaccines to try to help prevent cervical cancer, oropharyngeal cancers, anal cancers related to this virus. And because this virus is so easily transmitted through sexual contact, this vaccine is to try to help protect people from obtaining chronic infection with the virus. It appears that most young women will clear the infection on their own. However, 10% of women and a certain percentage of men, young or boys, as I go into men and again to their later life, can have persistent infection. And so the vaccine was developed to help these people or to help people not get the persistent infection. However, the vaccines only treat or prevent the infection of certain strains, high-risk strains of the virus. There are low-risk strains and there are high-risk strains. The high-risk strains, I'm just going to tell the audience, are numbers 16 and 18. But there are some other sub-high-risk strains that these vaccines do not protect against. Okay, so getting a vaccine doesn't mean that you are completely protected. The Gardasil does protect against 2 types of low-risk strains that can lead to visible warts or genital warts that are found on the vulva or the vagina or the penis. So Gardasil does provide that extra protection.
Mm-hmm.
what's interesting about Gardasil versus the Cervarix is that the Gardasil titers, now they're talking about mucosal titers. What's so interesting about women clearing this infection is that, why are some women clearing it and some women aren't? Well, it appears to have to do with the vaginal mucosa. It has to do with the immune system of the vaginal mucosa that can clear the virus. And there's research showing that girls who smoke, teenagers who smoke, are at much higher risk of having persistent infection. And they have found that when women smoke, these girls smoke, that there are particles of the tobacco smoke in the cervical mucus of these women, and that these particles interfere with the body's ability to be able to clear the virus. So when we kind of, as naturopathic doctors, we're interested in whole body health, and we're interested in looking at what we can do to try to have our patients, walk through this microbial world and not get these various infections, whether there be staph infections. In Hawaii, it's very common because of the ocean has a lot of staph in it, or whether they're viral infections. And, we've always had this idea that we want to support the host. We want to not just think of germ theory, but we want to support the host. We want to change the milieu of the body, or what we call the soil of the body. And this is a really good case for looking at whole health in teens and doing what we can do to try to enhance the health and vitality of these young women so that if they do get exposed to a virus, that they can clear it. And keep in mind, let's say they do get a vaccine, either the Gardasil or the Cervarix. These vaccines aren't going to protect them against all types. They do protect them against the number 16, which is the most carcinogenic of the HPV types. However, there are some subtypes that they could get exposed to, and the vaccine would not protect them against that. So looking at whole body health, I think, is really important here. And looking at whole body health, that translates into having excellent vaginal health and mucosal membrane health. The HPV virus you cannot do a blood test to see if you have HPV because you don't create antibodies in your blood to the HPV. You actually create it locally in the epithelium, or in the cells of the mucous membranes of the cervix. And the HPV virus has a predilection for where you have one type of cell in the cervix turning into another type of cell on the face of the cervix, so columnar to squamous epithelium. And it's there that the HPV virus can kind of wiggle in between those cell junctions and can gain a foothold. The girls who are at higher risk for HPV are those who have sex at a very young age, or first pregnancy can also put women at risk, because some of the cells from the cervix actually migrate out onto the face of the cervix at that time and can put them at higher risk for being able to contract HPV. So there's so much really fascinating information about this area of a woman's body and how her local immune system can fight the HPV virus.
Mm-hmm. And now, I'm going to interrupt you for a sec because I want to be sure we save time for you to give us some tips for how to improve our vaginal ecology and our vaginal health and our immunity and all of that. But before we go there, I just want to come back to a couple of points on the vaccine. So you mentioned that it's effective against the most cancer-causing viruses, at least those that we know of. Now, if somebody, say, has been sexually active at a young age, and then they or their parents say, wow, you know what, I think you should get the vaccine, and unbeknownst to them, they already have contracted HPV, is the vaccine going to be helpful for them at that point?
No, it will not. However, they are working on one for that population, but we do not have one yet.
Mm-hmm. So those women really are going to have to pay attention to what you're going to tell us about how to have a healthy immune system and so forth to try to reduce risk. And in general, then, are there people, or is there an age at which this vaccine, in your opinion, is most indicated?
Well, I think it's a conundrum, honestly. You know, it's a situation where, according to this World Health Organization and the CDC, we want to vaccinate, they want us vaccinating our boys and girls starting at age 9 to 12 in order to get the vaccine into their bodies before they become sexually active. Because once they are sexually active, they could have been exposed already to the virus, and it could be too late. So it's recommended that this vaccine be given to children before they even have maybe even sexually matured.
And I mean, I understand that from the perspective of what we just talked about, that you need to get the vaccine in there before sexual activity so that it has a chance to prevent the potential infection. But that leads to a couple of other questions. Number one, are there side effects or there risks associated with the vaccine? And number two, let's say somebody gets it when they're 9. Is that it? Are they good for their life, or do they have to get boosters?
Well, that's a great question. What they found with Gardasil is that titers, which are taken through the mucus of the vagina, okay, not through the blood, are not protective beyond 5 years, which supports the belief that boosters may be necessary before the 15-year threshold for actual cancer prevention, okay? Whereas Cervarix, this newer vaccine, which actually protects women with more than just the 16 and 18 types of HPV, which can lead to cancer, it actually provides more protection, actually provides higher titers of 8.4 years instead of 5 years for Gardasil. And antibody titers in cervical mucus are also superior with the Cervarix. So, and the whole key here is that it's the cervical mucus where all the action happens in terms of immune system integrity, in terms of being able to clear the virus.
Okay, so you've made the case that if somebody's going to get the vaccine, they have to get it early when they're young, and they're going to likely need a booster. So what's the downside? Are there side effects? Are there risks associated with this vaccination program?
Okay, so vaccines can always come with a risk, depending on who's getting it and how they respond to it. And Gardasil has had side effects of headaches, gastroenteritis, appendicitis, pelvic inflammatory disease, asthma, spasms in the bronchial tubes or bronchospasm, and arthritis. Adverse events for Gardasil could be either from the Gardasil or from the adjuvant that's added to the Gardasil to make it more effective. So a lot of vaccines are given with this compound that helps make a vaccine work better. And there's some concern about the aluminum adjuvant that's found in the Gardasil. And it's actually an aluminum hydroxide. And the side effects from that can be pain, swelling at the injection site, or fever. Can also be headache, fever, nausea, dizziness, vomiting, diarrhea, myalgia. One of the biggest concerns is Guillain-Barré syndrome, which is like a mild paralysis that's self-limiting, and that means that it resolves within a certain amount of time in some individuals. And in 2006 to 2009, it was found that there was nearly 2.5 to 10 times greater risk of Guillain-Barré syndrome within 6 weeks after Gardasil vaccination when compared to the general population. And typically, that syndrome was reported within the second week of vaccination. So there are possible safety issues in terms of the adjuvant, the aluminum, and there are issues regarding the Guillain-Barré as well as some of these other potential side effects.
And these side effects, I mean, what you have said are quite serious, really, in terms of side effects, but I would imagine that they're not all too common. I mean, most people that get the vaccine do not develop side effects. Is that a safe statement? Yeah.
That's true. Mm-hmm.
Okay. All right. So any other, I mean, do you, I don't know, I'm going to put you on the spot a little bit, but how do you counsel your young patients or parents with children that are of, the ages of 9 or above about this issue?
Well, I've been thinking about that. I really counsel the parents, first of all, because they're the ones that are having to make some decisions with very young people. Second, in terms of counseling them, I just give them the facts and then let them make their decisions. And I think a lot of parents are very concerned. They want to make sure that they do the right thing for their child. I think this is a fairly new vaccine, so a lot of people and parents are quite hesitant to just jump in and go ahead and do it. However, I also have parents who said, you know what, my daughter's attractive, and she's going to go off to college someday, and I want to make sure that she's covered. However, I think that parents need to know that they're not really covered. They're kind of covered, but they're not really covered because the vaccines don't cover all the cancer-causing types of HPV. So I think that parents need to know that as well. And they also need to understand that their son or daughter could be exposed to it, and then they could clear it as well. So I think that it's really a conundrum. There's no perfect answer to this. However, I think that just educating young people and young teens, like when I'm talking to teens and parents. So I have a 16-year-old patient who's really this bright, young, intelligent, vivacious woman who's also got tattoos, and she has lots of piercings, and she's a smoker, and she's very sexually active. Do I want her to go and consider getting this vaccine? I would say yes. However, she's already been sexually active. Has she had an abnormal pap yet? No. Have we tested her with a pap and to test for HPV? Yes. Has it shown up? No. Has she been exposed to HPV in the past? Maybe. Maybe she cleared it. So, it may be that it's too late for her to even consider getting the vaccine, right?
Mm-hmm. Mm-hmm. So if she's negative for it now, if she's cleared it in the past, she's not going to benefit from the vaccine?
Well, the HPV could be under the radar. She could have already been exposed to it, but it's under the radar, and we're not able to actually test for it yet.
Mm-hmm. Yeah, so it's quite complicated, and I think you're making a really good, you're drawing out a good scenario. There's lots of factors to consider, and there's not a right answer, which means that there's lots of right answers, although I do think that a part of the right answer is to improve the hosts, and you alluded to this early. We're going to take a break. When we come back, I want to spend the entire last segment of the show talking about some of your strategies to improve immunity, to support the health of the vaginal area so that we can improve people's chances of clearing the virus on their own. So we'll take that up when we come back from our break.
We are constantly being bombarded by toxins in the air we breathe, water we drink, and even the foods we eat. So what's the answer? Glutathione. It's inside every cell in your body and protects you from the damage of oxidative stress and toxins. There's a special patented form of glutathione that is superior called Cetria. Cetria is pure, vegetarian, and allergen-free. Help replenish your body's reserves of this very important nutrient, detoxified a natural way. Visit CetriaGlutathione.com. That's CetriaGlutathione.com.
Stress has become a part of our daily lives. We become sleep deprived and sapped of energy. Fortunately, there is a natural product that can help. L-theanine is a special amino acid found in green tea that helps us relax while keeping the brain alert and active. Tomorrow's Nutrition Suntheanine delivers 150 milligrams of L-theanine per capsule. Suntheanine has been clinically proven to reduce stress, improve focus, and help us sleep. For more information, visit tomorrowsnutrition.com. As a special bonus, listeners will receive 20% off any order by typing in 5 to Thrive when they check out at Tomorrow's Nutrition. Tomorrow's Nutrition and 5 to Thrive are a great combination. Don't forget the code 5 to Thrive at tomorrowsnutrition.com and get 20% off your order.
Are you interested in boosting your brain power? So am I. This is Carolyn Gazella, co-host of 5 to Thrive Live, and I'm here to tell you about a supplement that I take. The human brain needs a lot of nutrition to stay focused throughout the day. Citicoline naturally enhances energy-producing centers within the brain. Cognizin delivers a clinically tested, patented form of acetylcholine that supplies your brain with the energy it needs to stay sharp. Look for Cognizant on the label, or for more information, visit cognizant.com. That's cognizant.com.
Welcome back to 5 to Thrive Live. I'm Dr. Lisa Schuler, tonight's host. Tonight I'm with Dr. Laurie Steelsmith. We're talking about HPV. I forgot to mention, if you have a question for Dr. Steelsmith, to put your question into our general chat box, which is collapsed on the lower right side of your screen. You still have a chance to do that. Hopefully she's going to anticipate your questions in this last segment, because we're going to now switch a little bit off of the vaccine per se and talk about some strategies that people can employ to help their own health, help prevent the risk of HPV infection, and increase their chances of clearing it. So, that's a big thing, but I'm just going to leave that open-ended for you, Dr. Steelsmith, and just go ahead and start us off.
Okay, so one of the things we want to think about is the health of our vaginas. And they have found that women who are at higher risk of having persistent infection are women who have chronic inflammation in the vagina from bacterial vaginosis, which is an overgrowth of bacteria in the vagina. And this actually changes the pH of the vaginal mucosa, and we want to make sure that we correct that. And that can be corrected with natural medicine. You do not have to use antibiotics for that. And there are a number of different products that we use, such as Golden Seal douches, or even Golden Seal suppositories that are in cocoa butter. I use a lovely product called Tanafem. I'm sure you can buy that online, Tanafem. Dr. Leese, is there anything that you use for BV that has been a particular fantastic product?
You know, I've actually used boric acid, which sounds scary, but it's not. It's a very gentle acid mixed in with, like a douche. That works really well also.
And then putting in the hydrogen peroxide producing friendly bacteria called lactobacilli, that's a very specific strain for the vagina, can also help to correct the BV. So if you are a woman who's getting chronic vaginal infections, it's a very good idea to correct that with natural medicines and reestablish healthy flora in your vagina. They've also found that women who have concomitant infections like chlamydia are at higher risk for having persistent infections. So make sure you get your annual PAPs, make sure you get screened. If you have a new sexual partner, I think it's a really good idea to go in and get screened, and especially if you didn't use a condom, had unprotected sex, just make sure you're not a chlamydia carrier. Chlamydia is insidious. You don't know you have it until it's already caused, problems. It can also lead to infertility. So make sure that you get good screening for that. They've also found that women who are using birth control pills are at higher risk for persistent infection, and that's because birth control pills actually change the mucus, and that's one of the ways that it works, that it impedes the sperm from being able to swim gallantly up through your cervix and into your uterus to impregnate and to fertilize an egg. So one of the ways that birth control pills work is it actually changes the cervical mucus, and having healthy cervical mucus, as I said earlier, is what helps women to clear the infection if they're exposed to HPV. We had already mentioned smoking, but gals, if you're smoking, or women, if you have daughters who are smoking, see what you can do to convince them to do otherwise, because smoking does put women at risk for persistent infection. Very important. And then also I think we need to look at immune status. Let's make sure that you've got adequate zinc. Go see your naturopathic doctor. They can do a very simple zinc tally test, which you put the stuff in your mouth, you swish it around your mouth, and if it tastes horrible, it means you've got great levels of zinc. And if it tastes kind of sweet, it means you really need zinc. So go see your naturopathic doctor. They can also run a SpectraCell analysis and look at your red cells and make sure that you have all the nutrients that you need. Eating a good diet, healthy diet, you don't need to be neurotic, but just eating a diet that is like good fuel for your body, high-octane fuel for your body, that's really what we want you to do, which means lots of vegetables, good quality fruit, good quality protein, Carbohydrates are okay. This whole crazy no carb thing. They're actually okay for your body, and your brain needs them for your brain to work. Okay, your brain uses 60% of your body's glucose at any one time. If it's not getting that, then your brain doesn't work very well, and you don't feel well, and then you don't make healthy choices. So eat good quality complex carbohydrates. If you are pregnant and this is your first pregnancy, you are at higher risk for persistent infection. So make sure that you use protection. Okay. So those are some really key things that I want women to pay attention to.
Yeah, boy, that was a long and extensive list, and I have to pick up, and it was great, and I have to pick up on the last thing, which we chatted a bit with each other about over the break, but you mentioned protection if you're pregnant. Now, protection is something that people often assume if they're not interested in the vaccine or they're not a candidate for the vaccine. They assume that, well, I'll just make sure that whenever I have sexual intercourse that, my partner is going to have condom and I'll be good to go. So is it that simple, or are there issues there as well?
Well, okay. So we do need mucous membrane to mucous membrane to transmit this virus. And but if the sperm has any HPV on it and it's on your rectal tissue, you could get HPV on your rectal tissue. Remember that men can have the virus on their testicles, and condoms don't cover the testicles, and that can then touch your vulvar tissues. Also, in female-to-female relationships, there can be transmission of the virus back and forth. So I think that we have to be aware that we can also get it through oral sex, and that this virus can affect the oropharyngeal area, which means the whole throat area, and people can get throat cancer from it later on in life. So yeah, condoms aren't necessarily the only thing that could protect you from getting this virus. I think that really the most important thing, I think condoms are a good idea. I think they're important. I think they're a great form of birth control if they're used correctly. But I think that we have to realize that we're not going to be 100% protected by using a condom, because the virus can occur and create problems on other mucous membranes.
Mm-hmm. And you sent an interesting article to me today about lubricants, which comes up when people are talking about condoms and other forms of barrier methods. So can you share a little bit about this? This is kind of a cutting-edge thing.
Sure. This is findings that just came out from the World Health Organization, Johns Hopkins, and the University of Pittsburgh. And what they've been doing is they've been studying lubricants and their relationship to osmolality. And what that means is they're looking at that so many lubricants have sugars and salts in them. And what happens when you use some of these lubricants, like KY jelly, for instance, that this has a very, very high osmolality in your vagina. It actually has a very low osmolality. So when you use KY jelly, or you use some of these other lubricants that have a very high amounts of sugars or salts in them, that they compromise the mucous membrane health of your vagina and your cervix, which could potentially make you at higher risk of contracting a sexually transmitted infection. This information is literally hot off the press, and it's fascinating information because there are lubricants on the market that have very low osmolality that are more consistent with your own vaginal fluids, and these lubricants can help to won't harm you. If anything, they just kind of act as nourishing lubricants that also help prevent any kind of micro tears of your tissues. Preventing micro tears is a really good idea too in helping maintain the vaginal and cervical health. So some of these natural products that are on the market is one that I use in my own practice, and I love the name. It's called Aloe Cadabra, and it's a 95 to 99% organic aloe product, and it's got trace amounts of vitamin E in it. It's a lovely product. I actually use it in my patients who are lactating. I use it in my patients who have breast cancer or going through any kind of chemotherapy to keep those tissues hydrated, and those, especially in those patients who cannot use any kind of estrogen at the vulva. It's a lovely product for using with condoms. It's a lovely product to use when you are having intercourse. And what they found with these high osmolality products like the KY jelly, Astroglide is another high osmolality product. In fact, there's a whole bunch of them that are online. Liquid Silk, Oh My Natural, actually Liquid Silk is lower. Anal Lube Original, Oh My, this is Oh My Natural Lubricant, actually is very high, up in the 4,000 range. And these products actually, what they do is they cause your cells to shrivel up like little raisins, and so they're not plumped up and healthy and vital and able to fight infection as well. And so we want to make sure that when we are using lubricants, that we're using lubricants that have this low osmolality, that is more consistent with our own vaginal fluids, and that don't cause disruption of our own cellular tissues.
Okay, so boy, sex can be kind of scary.
I thought that too.
With all this. But I think, on the flip side, you're also really giving us some very important tips and ways to improve health. So it sounds like it starts all the way back at diet. And then you're taking it forward and talking a lot about, improving specifically the integrity of the mucus in the area with really mostly avoiding things. And are there any and then dealing with infections and so forth, are there any maintenance type of programs that you encourage women to utilize to support healthy mucous membrane layers, like any regular douching programs or anything like that?
Well, actually, I really don't want my patients to douche because I think it disrupts that healthy mucous membrane. I only have them douche when they have an infection, and it's especially in Hawaii, it's a very clean way without a lot of cocoa butter in your vagina and without a lot of suppositories that are very hot and sticky. We live in a very damp, humid climate, so we want to use things that are more cooling. So I only have my patients douche when they really need to. I don't think douching on a regular basis is a good idea. In fact, I think it puts you at higher potential risk. Your vagina is actually very clean, and it has its own self-cleaning mechanism, so, please know that. Maintaining vaginal health is don't put anything in there that has this high osmolality, and you can look all this up online. You want to be using natural products as much as possible, and I think that if you do get an infection, let's say like you have somebody with chronic yeast infections, I highly recommend that you look at treating your whole body, not just your vagina, because it means that probably the soil of your body, we use that in quotes, has shifted so that it favors the growth of yeast, and so you want to treat your whole body in order to have good, healthy mucous membranes at your cervix and at your vagina.
Mm-hmm. Great. Wow. Well, that is good. We are almost out of time. We started a little late, so we have a few more minutes, and I'd like to give you the chance to just kind of summarize, if you will, some key takeaways for people listening related to HPV and sexually transmitted diseases, if you want to extend it a little bit, but just kind of some parting thoughts around this.
Well, my parting thoughts are that I think that we need to treat ourselves as individuals. We need to treat our daughters as individuals rather than that kind of idea of the herd mentality of treat everybody. And I think that if we help to raise our daughters so that they're making healthy choices, that they have high self-esteem, that they learn how to take good care of their bodies, they're going to be at much lower risk of contracting a chronic persistent HPV infection. If they do get exposed to it, like I said earlier in the show, 70% of women clear it in 1 year, 90% clear it within 2 years. In terms of the vaccine, I think that is really going to be a personal choice for the parents because the daughters aren't aren't old enough. They're too young to make that decision themselves. And I think just educate yourself on everything you can before you do make the choice about whether to give the vaccines. If you choose to have your daughter take a vaccine, then I recommend the Cervarix over the Gardasil because the Cervarix will treat more types of potentially cancer-causing HPV than the Gardasil will. And it has higher titers in the vaginal mucosa, so it will last longer, and it seems to be more effective.
Mm-hmm. Okay, good. Wow, well, you are a wealth of information about all this, and you've been very, just really wonderful in the way you've described this because it's a complicated topic, and I think you've really dissected it There's a lot more we could say, but I think you've hit the heart of the issue. So I want to thank you for spending some time with us. And if our listeners would like to find out more about you and your books, can you give us some websites?
Sure. They can go to drsteelsmith.com, and that's drsteelsmith.com. And I've got a lot of articles I wrote on there for the Honolulu Advertiser. I did that for about 10 years, so those are all free. They can download them. Articles on everything from, vaginal lubricants to how to treat a headache or how to make pumpkin seed milk.
Okay. Well, that's quite the variety. So that sounds wonderful. So that's drsteelsmith.com.
That's right.
Okay. Well, thank you again. It's been a pleasure and a privilege to have you on 5 to Thrive Live. And I want to thank you, our listeners, for joining us this evening as well. Tune in tomorrow night. We have another wonderful naturopathic doctor on, Michael Uzik, who's going to be speaking about proactive prevention of colorectal cancer, colon cancer. This is a very important issue, one of the most common cancers in both men and women. He's going to give us some very good insight into that. So tune in at 8 p.m. tomorrow night, and check out our website, 5tothriveplan.com. You can follow us on Facebook and Twitter at 5to3. And in the meantime, I hope you all enjoy the rest of your evening. May you experience joy, laughter, and love. And it is time to thrive. Have a great night, everyone.